Robert Largan.
Thank you, Madam Deputy Speaker. And it's a privilege to follow my honourable friend, the member for London and Westminster, speaking about her own personal experience and her rainbow baby. I don't think the term existed when I was born, but I'm my mum's own rainbow baby, so it was lovely to hear your speech. And it was also, I want to congratulate my honourable friend, the member for Truro and Falmouth, on her very powerful and courageous speech and all the work that she's been doing since she was elected. Baby Loss Awareness Week gives us all an opportunity to think about the families that have suffered this tragedy and what can be done to help. We've all heard a number of very moving stories in this debate. I cannot begin to imagine how painful this experience must be for bereaved parents. I appreciate how difficult it is for people to be open in public about the loss of a baby or a pregnancy. According to the Baby Loss Awareness Week Alliance, 1 in 4 pregnancies ends in miscarriage and 14 babies are stillborn or die shortly after birth every day. One of the most powerful things we can do to help those who've experienced this loss is to do everything possible to stop the same thing from happening to other parents. My constituency of High Peak is home to some really inspiring and hard-working maternity teams and bereavement organisations. And I want to take this moment to talk about one organisation in particular. My constituent, Ciara Curran, who asked me to share her story, lost her baby daughter, Sinead, 11 years ago in April 2010 to preterm pre-labour rupture of the membranes, also known as PPROM. This condition is when the waters break before 37 weeks of pregnancy and puts mother and baby at risk of infection. After such devastating loss, Ciara went on to set up an organisation called Little Heartbeats to help women who have lost a baby to PPROM and to ensure pregnant mothers receive the best possible care if diagnosed with this condition. Little Heartbeats has worked with the Royal College of Obstetricians and Gynecologists to produce clinical guidelines and patient information leaflets to help prevent the loss of babies from PPROM, and has launched studies of the impact of PPROM, as well as possible treatments like stem cell patches. In recognition of this work done by Ciara and her team, Little Heartbeats received the Butterfly Award for Best Support Organisation in 2017 and was shortlisted for the Sun NHS Who Cares Wins Health Awards this year. It is amazing to see someone who has dealt with such loss responding with tremendous courage and compassion. But we still need greater awareness and a clearer understanding of PPROM, helping us to better identify it and treat it. I sincerely hope that the Health and Social Care Committee will look into how this condition can be better managed and to learn from the stories of women like Ciara who've lost babies to PPROM. I've written to the chair of that select committee, who is in his place today, on this very point. I'd also add that in his speech, which he gave earlier in this debate, a remarkably powerful speech, and one which I sincerely hope the Minister listens to carefully. We also need to make improvements to antenatal and maternity care more widely. That is why I'm campaigning for an improved maternity unit and antenatal clinic for Tameside Hospital, which serves my constituents living in places like Glossop, Hadfield, Charlesworth, Gamesley and Tintwistle. The Charlesworth building at Tameside Hospital houses the current maternity unit and antenatal clinic. Originally built in 1971, it has poor insulation and problems with overheating that affects sensitive clinical equipment, including incubators for newborn babies, that impacts the well-being of patients and staff alike. Capital investment is badly needed to improve the comfort of patients and staff by improving insulation and providing new welfare stations and waiting areas. This will also deliver better care for mothers and babies by ensuring clinical equipment is not overworked. I very much hope that ministers will carefully consider Tameside Hospital's bid for this crucial project as part of the Health Infrastructure Plan, which alongside the planned new urgent care centre at Tameside, as well as the proposed emergency care campus at Stepping Hill Hospital and the long-planned new health centre for Buxton, would make a significant difference to healthcare provision locally. I also want to take this opportunity to thank all of the doctors, nurses, midwives, researchers and organisers that do so much to address this challenge. Ultimately, the NHS cannot deliver world-class care without the dedication and perseverance of its amazing staff. They deserve our thanks, but they also need our support. The Royal College of Midwives have said that maternity services are experiencing a shortage of 2,000 midwives. In a 2020 survey, 7 out of 10 midwives said they were considering leaving the profession. And the pandemic has put huge amounts of pressure on NHS staff. So it's vital that midwifery benefits from the government's £36 billion package of support for the health and social care system. It's also really important that bereaved parents can get specific support and better access to counselling. The Baby Loss Awareness Week Alliance carried out a 2019 survey revealing that 60% of parents who had experienced baby loss said they needed specialist psychological support but could not get it with the NHS. We need to improve access to counselling and invest more in prenatal nurses, giving them the right training to help parents who experience baby loss. If we're going to meet the government's national maternity safety ambition to see baby deaths fall by 50% by 2025, then action is clearly needed. There are lots of big... Of course.
I thank the Honourable Member for giving way, for him highlighting such important issues as counselling. Does he accept that the quadrupling risk of suicide of people who experience miscarriage should be taken into consideration in suicide prevention work?
To my constituency neighbour for her intervention, and absolutely take that point. Definitely needs to be fully taken into consideration. To bring my remarks to a conclusion, there are lots of big, difficult issues that this House has been grappling with these past months, and we often have heated debates, and I'm sure that we will have many more for the foreseeable future. But there are times like this when parliamentarians can come together to try and find solutions to our shared challenges. Let's work together to help those who are going through the darkest of times and to give them the hope that things will get better.
James Sunderland.